I'm Maria and I'm working in epilepsy research. Epilepsy is the fourth most common brain disease. People with epilepsy suffer from epileptic seizures. The primary treatment is medication, but it is not always effective. Another option is epilepsy surgery. But not everyone is eligible, and even for those who are, there is still 1 out of 3 patients who continue to experience seizures after the surgery. And this is why some researchers are investigating which are the factors that are associated with surgical success. In my thesis, I study brain networks, and more specifically, how different brain regions synchronize, because this synchronization is linked to the surgical outcome. To decide surgery eligibility, the medical team performs a variety of tests. One of them is electroencephalography, or EEG, where electrodes are placed on the scalp of the patient to record brain activity. Another tool is intracranial EEG. Same idea, but this time the electrodes are placed inside the brain, and that requires a small surgical procedure. But what is the difference of the two? Let's imagine that I'm sitting outside an opera house trying to hear the music. This is like EEG. We record brain activity, but it is distorted. Now, let's imagine that I'm sitting inside the opera house, hearing the music clearly. This is like intracranial EEG, where we record the real brain activity, but it is invasive. In my thesis, the broader goal is to see if we can rely on brain networks to extract additional information about the surgical outcome. But like we said, EEG recordings are distorted. And this is why I apply special methods to the EEG to reconstruct brain activity. But how can I be sure that what I estimate is actually correct? Well, I'm using a unique dataset of EEG and intracranial EEG that were recorded at the same time. In that way, I can use the intracranial EEG that record the real brain activity as my ground truth to validate two things. First, whether we can reconstruct real brain activity from EEG, and second, whether EEG-based brain networks correspond to the real networks. After that, we can estimate the synchronization between different regions and associate it to the surgical outcome. In that way, we can provide medical doctors with additional information about which patients are more likely to benefit from epilepsy surgery, and all that in a non-invasive way.